That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other. Hey everybody, welcome back. This is the Real Health Podcast with Brandi and Amir. I am Dr. Amir Rashidian, a chiropractor, and Brandi is the
I'm just Brandi.
boss, my wife, and partner, and everything else. And she also has an amazing brain, which is why she's here, because she helps me keep things in order. And the Real Health Podcast is where we like to teach you how to feel better, get stronger, live longer, and feel younger.
That's right.
So what we do is we take the latest articles, latest news in health and wellness. We summarize it for you, and then we'll tell you what it means to you, how you can apply it to your life, and what you should look out for. So hopefully you find it valuable and interesting. We have quite a few very interesting articles today.
Some fun ones today.
And one of them kind of follows up with what we talked about last podcast, where we talked about how insurance claims or insurance decisions should not be how we determine healthcare. That in fact, the doctors who are doing the examination should determine how treatment should be done, not the insurance company. Because what the insurance company does is it predetermines what's going to be covered and what's not going to be covered.
Correct. So we were initially, and this is something that's been going on, for years and years and years. So a doctor says, hey, here's the diagnosis for this patient. Here's what's going on. Here's my recommendation of treatment, because I'm a doctor. I went to school for this. I've seen a lot of patients who have this condition. This is what I believe will get them to their best health, right? And then they send that information in to the insurance company, and the insurance company goes, wait a minute. Sorry, Sean, I made some big noise there. Wait a minute, that's going to cost us an awful lot of money. So we're going to go ahead and deny that. We're going to let you do something more conservative, which is just wait and see what happens. And then if it gets really bad, we'll consider it. Like, at what point, and by the way, this is not another physician making this decision. And even if it were, and sometimes it is, but that physician is not in front of that patient. Why is it that we find that the doctors who are with the patient do not have, we'll let them pick up a scalpel and go into an ER and cut somebody open, but we won't let them make a determination on the path that they believe is going to get their patient better the fastest? Like, what is wrong with that? That's a person with
and why
a
are we
business
making
degree.
health decisions based on what saves the insurance company the most money?
Absolutely. So now
it seems so unethical.
It is unethical. It doesn't even seem that way.
So
it is.
We've always said we're not anti-medicine, we're not anti-drugs, we're not anti-surgery, we're not anti-medical doctors. You know, we think all of that has its place. We think drugs and surgery should be last resort, but we're not anti those. But I think we are a little bit anti-insurance companies controlling healthcare.
Oh, 100%. Because we're not making decisions that are in the best interest of the patient. We're making decisions that are in the best interest of the insurance company. And that is never going to lead to good health.
That's why our doctors in our offices don't sign those contracts with insurance companies. We do not participate with them because they make us sign contracts that says we would only recommend what's going to be covered, and we would not recommend to. We're not even allowed to tell the patient, hey, this is what you need, but your insurance is going to cover this. We're just going to say this is what insurance covers, so this is what you have to do, and we refuse to play those games. That's not what's right for patients.
Correct.
And I think more doctors need to do that.
I think so too. And there are more now than what were even 10 years ago.
Yeah.
Now we have somebody else coming. Now we've always had a third party in some insurance companies that are the ones to make those determining factors. There are companies such as Cigna, and there's several others now that actually use a third party company to actually determine whether or not somebody should get the benefits that are clearly on their plan. This is the kicker too. These are benefits that the consumer is paying for. You're paying for it, or your employer is paying for it. And the insurance company gets to say at some point, although they have no idea who you are, they've never sat in front of you before, but now they get to go, yeah, I'm sorry. I know this is in your list of benefits, but we just really feel that this is not going to be the best thing. Not for you, but just the best thing in general. So we've always had those. Now we have AI entering the the scene.
Well, no, that's controversial because in the article they deny. So let me read the article
Go
first
ahead.
because they're denying that they use AI, but
Hmm.
there's some evidence that says they are. So this is from USA Today. That was a big preamble for the article. Here's the title of the article. It says, "Is your health insurer using AI to deny you services? Lawsuit says errors harmed elders."
Mm-hmm.
For years, vital decisions about who got medical care coverage took place in back offices at health insurance companies. Now, health insurance companies. Now, some of those life altering decisions are being made by artificial intelligence programs. At least that's the contention of the two families who sued United Health Group this week, saying the insurance giant used emerging technology to deny or shorten rehabilitation stays for two elderly men in the months before they died. They say that United Health's artificial intelligence, or AI, is making rigid and unrealistic determinations about what it takes for patients to recover from serious illnesses and denying them care in skilled nursing and rehab centers that should be covered under Medicare Advantage plans, according to a federal lawsuit filed in Minnesota by the estates of two elderly Wisconsin patients. The lawsuit, which seeks class action status, says it is illegal to let AI override doctors' recommendations for these men and patients like them. The families say assessments like that should be done by medical professionals. So, anyways, that's what I meant is that they're saying it was allegedly used AI that did it.
Right. But the company does use algorithms to determine coverage plans and override doctors'
Which is
recommendations.
pretty much the same thing. And
So-
overriding a doctor's recommendation should be illegal
Right.
because you can't have people with finance degrees and business degrees making decisions about someone's health.
Yes. And by the way, even if you do have a medical degree, but you have never practiced,
Right.
sorry, for me, you don't qualify.
At that point, you're a statistician.
Yes.
You're looking at stats going, oh, the majority of people need this, not that. Or this costs more than this. And the results are almost as good.
Yeah. Listen to this. This is astonishing, people. More than 90% of patient claim denials were overturned through appeals or federal administrative law judge. 90%. That's
Yeah.
huge. I just cannot believe. I mean, think about how many denials come through.
Yeah. It says in reality, few patients challenge the algorithm's determinations. A tiny percentage of patients, 0.2%, choose to fight claim denials through the appeals process.
Yeah, they're just paying out of pocket when the insurance should be covering.
Right. So my suggestion, advice to you is when something gets denied, fight it.
Yeah.
The attorney said the high rate of denials is part of the insurance company's strategy. They're placing their own profits over the people that they are contracted with, and then legally bound to cover. United. So, anyways, this is one of those instances where I love the attorney.
Right.
Every once in a while, I'm not a fan of certain things that attorneys do, but
Sure.
in this case, this is great.
Yeah.
That's exactly what I would believe. Now, United Health told USA Today in a statement, Navi Health's AI program, which is cited in the lawsuit, isn't used to make coverage determinations. The tool is used as a guide to help us inform providers, families, and other caregivers about what sort of assistance and care the patient may need both in the facility and after returning home.
I have to giggle though, because we know that these are some of the same companies that if the people dealing with the claims approve too many, they get in trouble.
Yeah. They're the adjusters, the insurance adjusters.
Yeah.
They actually get in trouble because they spent too much money.
It says coverage decisions are actually based on Centers for Medicare and Medicaid Services criteria and consumers insurance plans. That's what the company says. They said that the lawsuit has no merit, but we know that it does. And this is something, even without the AI, they they should have we should have
Let
been
me
doing
ask
this a
you.
long time
Let me
ago.
ask you this: why do we even have doctors?
Right. I mean, if we have insurance companies.
Why don't we just go directly to our insurance company and say, "Hey, I've got a cough and I've got a fever. What do you want to give me that I don't have to pay for?"
Well, just to let you know, there are most of the companies now do have a service that they're pushing, like a wellness nurse. They want you to call in.
Hmm.
They're owned, they're paid by the insurance company.
Wow.
And you can go and get recommendations and whatnot directly from the nurse at the insurance company.
Remember, if you
It's a
say
benefit.
if you ask for weight loss drugs, they'll say no. That was last part of the podcast. Anyways, the article then follows these two elderly gentlemen who actually passed away um, during their rehab phase. And I don't want to get too far into it, but the one part that was important was these families are, because insurance denied care, they ended up paying for the rehab on their own. It says without coverage, the family had to pay $12,000 to $14,000 per month for about a year of therapy at the facility. So insurance denies this, and then the family is paying $14,000 a month for a year.
Yeah. But that's okay because the insurance company is making money.
That's close to $200,000 they spent. And for the other family said they spent $70,000 on his care during the next 10 months. So insurance said we'll only approve 20 days. The doctor said you need 100 days at the rehab center.
What does he know?
Yeah, so this is a doctor who examined them, did the treatment, whatever, surgery, whatever they did, said you need 100 days of rehab at the rehab center. The insurance said we'll approve 20 days. Then they fought it, and the insurance said, okay, we'll approve 20 more days. But what about the rest of it? So he stayed there 10 months. They spent $70,000 out of pocket.
Yeah.
Meanwhile, they're still paying the premiums for that insurance.
Yes, and let's not forget the time that people are spending conversing. If you want to know why we went out of network, part of the reason was because we were going to have to pad the walls of our business office because I was one of those people trying for our patients, hollering at insurance companies every day. My stress level was through the roof because I knew they were doing things that weren't legal.
Can I call my insurance company and say I'm denying your premium payment this month?
They would not know what to do.
I'm denying my premium payment this month. You can't cancel my policy, but based on my AI that I have at home, called my wife.
Although I'm not artificial.
No, she's very real. Anyways, definitely intelligent. So we'll say on real, natural intelligence. And there's one other thing in here. This is why I said always fight the claims. This woman wanted 3 months stay at a rehab center. She filed and won 10 appeals after an insurer repeatedly attempted to terminate her coverage and limit her stay. So remember, only 0.2% of people fight these claims. Mm-hmm. Fight it. They have to approve it. Especially if it's life and death. And now you have documentation that you fought it. And if they still don't approve it, and God forbid something terrible happens, you can go after them. And I would love to see them have to pay. Yeah. Anyways, sometimes, what does it say? Sometimes AI systems aren't reasonable, and they don't have common sense. So you have to have a human in the loop.
We have a huge population that lacks common sense.
There's some people who don't have common sense. Sometimes can just be completely wrong. So anyways, don't trust AI all the time. Next article.
Life expectancy.
That one got my blood boiling a little bit.
Yeah, I was feeling a little hot under the collar too. So it does get me a little revved up. I was trying not to beat the table because I get in trouble.
That's right. This one's from U.S. News. It says, too few seniors get follow-up care after a serious fall. 4 of every 10 American seniors who suffer a fall and end up in the ER with head trauma get no follow-up care once they go home. This is a new study that found this. They often get no guidance on how to prevent another fall. Of the patients in our study that had primary care physicians follow up, 28% reported that there was no fall risk assessment, and 44% did not receive fall prevention interventions. So now, why aren't we doing this in advance before the first fall? No one's talking about that. They're just saying, oh, if someone's already fallen and hit their head and got seriously injured, let's teach them how to prevent another fall. Like, why don't we teach them how to not fall in the first place?
That would be more wise. That's what we do with patients every day.
That's what we do in our office. Anyways, falls can be highly injurious and often fatal for older Americans. According to data supplied by the university, in a given year, 1 in every 4 Americans aged 65 or older will suffer a fall, resulting in 8 million emergency department visits annually, 800,000 hospitalizations, and more than 27,000 deaths.
That's a lot of preventable deaths, people.
You know, my father died after falling.
Yeah.
He fell, he hit his head. We don't know how long he was unconscious.
Yep.
By the time they found him, he had aspirated, his lungs were infected, he had pneumonia. They didn't know because they were worried about his head injury, so they never checked. By the time they found out, he had sepsis, bacteria throughout his blood. Otherwise, he would have lived. Now, this year, he would have turned 100.
That's crazy.
He was born in 1923.
Wow.
We're going to talk about life expectancy next.
Yeah.
So we'll bring that back up. Seeing your family doctor after you've recovered from a serious fall is crucial to helping prevent subsequent falls, the Florida team said. Unfortunately, that kind of follow-up often doesn't happen.
Yeah. People, we have to work out. Can I just exercise is not just vital for your overall health, but it's vital in keeping your muscle mass up, in improving your bone density, in creating balance and stability, and the ability to overcome a fall if you do fall.
Yeah.
Right? Like there's so many things.
Literally, if you have enough muscle and you're coordinated, even when you fall, you can brace yourself, you can stop the fall.
Yeah.
And when you hit the ground or hit something, you don't get as badly hurt.
Yeah. You know, I was doing a care plan presentation with one of our patients this morning at our South office, and her and I were talking. She's like, "I'm 47 this year. I really need to, I need to make sure that I was never very physical when I was younger. You know, I never worked out. I wasn't in athletics. I was really tiny, and it just wasn't the thing that she did. So it wasn't her strength. And now she's like, wait a minute. There are things I should be able to do better, or there are things, you know, her kids are all
like get
almost
up off
all
the
grown.
Floor without having to use your hands or having to hold on to a handle.
We don't think, what kind of grandparent do we want to be?
Right.
Like we had kids way older
That's
than
right.
what a lot of people did, right? I
Yep.
was 30 something.
You were 33, I was 35.
Yeah, when we had our first. And so that's in the grand scheme of things, right?
Most
I was
people have
young.
all their kids in their 20s.
People I went to high school with are grandparents now, and like my baby is 7, so I'm not even thinking grandkids.
Yeah, our youngest is 7.
Yeah, our youngest is 7. Is that what I said?
You said my baby. Yeah.
Oh yeah,
but
my baby.
I
my
just wanted
youngest.
them to know that wasn't
But
7 years ago that we had our first.
Right, but so like how healthy do I want to be when my grandkids finally come along, right? I can't wait until I'm a grandparent to go, oh gosh, now I got to get into the gym. I got to make sure I can pick them up and lift them. Like these are things we have to be thinking of at a young age, right? And if we create those habits as kids, teenagers, young adults, they will follow us through and we will be healthier and have more ability. Doesn't mean we're never going to have a health issue or a health concern,
Correct.
but we're going to be able to enter that health challenge and face it in a way we could not face it otherwise.
Correct.
So get in the gym. Like we have a great person we refer our older patients to, our more mature patients, and he does an absolutely unbelievable job. Daniel over at One Life Fitness
Hi, Daniel.
South. He does a fantastic job of taking our patients and getting
Eric
them.
and Randy.
And Eric
team,
and Randy.
The team.
They're unbelievable
Eric
over there.
oversees the team, and they're all just incredible.
So if you're not sure, contact us, shoot us a message, and we will connect you with that group, and they can help you. We have so many of our patients going through. Your aunt.
My mom and my aunt.
Both go through there as well.
Mom's 76. My aunt is 72. 72 or 71.
Yeah, and his aunt has broken her back. She's broken her arm. Like she's has a lot of stability issues. She is in her
She
80s.
used to always be injury prone,
Oh my
always
goodness, she was
falling.
constantly falling.
We couldn't
She,
walk through an airport without her tripping over her suitcase, even though it's behind her.
I don't mean to laugh, but it's a little. It was
Yeah.
a little much.
Yeah.
Anyway, okay. So back to that was my rant.
Anyways,
that was a rant. Sorry.
you know, they're talking about going to physical therapy after you fall, and I highly endorse that. Physical
Yeah.
therapists are amazing at teaching. In fact, occupational therapy is even better.
Yeah.
You know, if someone's fallen and you're injury prone, find an occupational therapist. In a lot of states, they are direct access, which means you don't have to go through your primary care to get into an occupational therapy practice. But they're the ones that can really teach you how to use your body properly,
Yeah.
how to walk with coordination and step over things and
Yeah.
and climb steps and pick up things. Occupational therapists are geniuses.
Yeah.
And I'm a chiropractor saying this, but I highly endorse them. Physical therapists also, but definitely occupational therapists. So, when referred to physical therapy, patients may be more likely to adopt fall prevention interventions and home safety modifications that have been shown to reduce recurrent fall, hospitalization, and mortality. We strongly endorse that fall risk assessment and patient education be performed in the emergency department or by the primary care physician. So, one of the things I tell our elderly patients is, first off, hopefully you brush your teeth twice a day. So one of those, brush them with your left hand if you're right-handed. You know, just alternate, brush with the other hand, just to create some coordination between both hands, and stand on one foot at the counter where you're brushing your teeth.
Yeah.
Now, if you're brushing with the right hand, your left hand can be on the counter to help you with balance. Pick one foot up and just learn to be able to stand on one foot.
Yeah.
That alone, and brush your teeth for 2 minutes, right? So last podcast we talked about brushing teeth, and they talked about brushing for 2 minutes. So 2 minutes, and then the next time you're brushing, alternate hands, stand on the other leg, and use the counter for balance so you don't fall. And you'll start to learn how to stand on one foot and do other stuff. That alone can be huge in preventing falls.
Yeah.
But don't wait till you've had your first fall
Correct.
before you do that. We just heard news yesterday that one of our beloved patients, she fell the day after Thanksgiving, broke her hip, and they did surgery. Now she has to be in a rehab center for a few months.
Yeah. Sad.
Falls are very difficult. Posture is very important too. So you postural exercise. In fact, I can plug this if it's okay. We did a talk at Homewood. Homewood is a assisted living place.
They have
but
assisted living, full skilled. I think they have the gamut.
they're very active. Everyone is there though, so they definitely
Amazingly.
they're definitely healthy and taken care of. But anyways, we did a talk, and that talk is on our YouTube channel, and you can watch it. And it talks about how to improve your posture and how to improve your balance.
Yeah. It's
So
a great one.
it's geared towards the elderly, and we're teaching you how to live longer by improving your posture.
Yeah. Somebody said to me earlier, it might have been your aunt, but I've heard this from a few people recently. Getting older is not for the faint of heart. Do you know what I mean? So, but let's make it easier, because what we do today affects how hard or easy aging is. But we have to think about it now. I mean, nobody likes to think about getting older, right? But the reality is we are all doing it right now. Stop right now. Yep, just got older. You it's happening. You can't stop it. But you can make sure that you do it well. So
Yeah.
do it well.
Absolutely. And we're all also dying.
Not me.
It's a little morbid news, but Michael Landon said I wish I don't know if you remember, he had brain cancer. He was
Little
the
House on the Prairie.
actor. Yeah, he was a famous actor, very beloved actor. He had brain cancer. So he did an interview, and his head was bandaged during, I think it was bandaged during the interview. He had just this positive, glowing energy about him. He was happy, upbeat, and he knew he was dying. They knew he wasn't going to live another few months. And he said, I wish from the moment I had some type of intelligence, someone would tell me you're dying someday, because I would have lived my life better.
Yeah.
And since I found out that I'm going to die in a few months, I've been doing everything I want to do, and I've been living a more enjoyable life. So anyways, we're all dying, so let's enjoy the time that we have.
Sounds good to me.
Absolutely. So speaking of life expectancy, this is the article we're coming up to, is living So this is from Healthy Living, Everyday Health, and the title of the article. I lost my tongue for a
You
second.
almost had it.
What's in this drink?
Just caffeine.
Life expectancy gap between men and women grows wider in the U.S. That's weird. You're gonna live a lot longer than me.
Yes, I am.
Good thing I'm older.
Well, reality is, I don't think you could handle it if I died first. Sorry.
I'm not gonna argue with that. The gap between life expectancy of men and women has reached its widest point in over a quarter of a century.
Mm.
Women in the United States are now outliving men by an average of nearly 6 years. With COVID-19 and drug overdose being largely to blame for the difference, according to analysis of mortality data from the National Center for Health Statistics published this month in the Journal of American Medical Association Internal Medicine. So you're going to live 6 years longer than me.
I will
It
miss you every
says
moment.
for more than 100 years, American men have been dying earlier than women, largely due to heart disease and lung cancer. But the trend had been improving since 1979, when the gap was at nearly 8 years, according to data from the CDC. In 2010, the gap had sunk to a low of 4.8 years. By 2021, the gap had climbed to 5.8 years, meaning women were expected to live an average of 79.3 years, while men were expected to reach the age of 73.5. When looking at U.S. adults overall, both men and women, life expectancy rates have dropped steadily. So in 2019, the overall average human life expectancy in the U.S. was almost 79 years. 1 year later, it had dropped to 77, dropped by 2 years. 1 year after that, it dropped another year to 76. So,
I'm going to keep the higher number.
well,
We
listen,
get to choose.
this is the thing, and I want to. We did a short video on this. It was probably 7-8 minutes long. Watch that. It was one of our recent videos on YouTube. But here's what I talked about: is that is such a false indication
It is.
of how long we live, because very few people die at age 79,
Yes.
or now it's 76. Most people will die before it or after it, but the average is 76. And so think about this: if there's only 2 people in the world, one of them dies at the age of 1, the other dies at the age of 99, you would say life expectancy is 50.
Right.
Because you add 1 to 99 and divide by 2, you get 50. But neither of them died at the age of 50. One lived to be 99 years old. And so I think the reason life expectancy is going down is because a lot of young people are dying.
And which is very scary.
Very scary. We're seeing a lot of young people with cardiac arrest,
Yes.
a lot of athletes with cardiac arrest.
Yes.
And then we're seeing people die unnecessarily from lifestyle diseases,
Right.
like the vaping situation we talked about at the last.
And this is all
podcast.
really has been declining since 2019. Right?
Yeah. So they're blaming it on COVID, but before,
Well,
bottom line.
COVID and drug overdosing.
So when my dad was born in 1923, life expectancy was 56 or 57.
Mm.
He lived to be 88.
It's pretty darn good.
Nelson Mandela was born around the same time.
Mhm.
He lived to be 91, I believe.
Yeah.
But life expectancy was 56. So how do you explain that? There people who were born in the 1800s, their life expectancy was like 30 something.
Right.
But there's all these famous people, and we talked about it in the other video. They all live to be in their 90s and 80s and 90s. So do not think that this is how long you're going to live. You're not going to live. You're not going to live to be 76 and then suddenly die.
Mm-hmm.
That is not a fact. It's because they're averaging all the children who die at birth. They're averaging in the kids who die of accidents. They're averaging in the teenagers in gangs who are shooting each other up. They're averaging in people who die in car accidents in their 20s and 30s because they're reckless. They're averaging all of that in, and that's what's lowering life expectancy.
Yeah. They do say another factor that may be keeping the spread from widening further is reported increase in deaths related to pregnancy and childbirth. So they are admitting that that is something that is happening. Of course, they're pointing it all back to COVID illness, although there are also some people who say it could be what we're doing to prevent COVID also has side effects. So it's not just COVID itself, because COVID is a virus like the flu. So there are other things that we have done to try to mitigate COVID
And
that is contributing
we
to
can't
that.
say much more.
We can't, but let's
But
just
what you just said right there, I hope you heard what she said, because that was powerful. That was powerful and that was huge. And we're going to leave it at that because, anyways, it's kind of controversial and dangerous, and they don't want us talking about that.
Yeah.
Which is sad. I'd love to talk about it. So it says men may tend to eat more unhealthy diets than women, drink more than women. Women seem to embrace more the idea of doing what's healthy. Men may also be more reluctant to go to the doctor, get a checkup, and seek healthcare when needed. And so it says we need to redouble our efforts in prevention.
Yeah, it also says this is a wake-up call for the public health to redouble our efforts in prevention. COVID deaths are largely preventable now. Okay, so now that we're saying I just want us to watch this. So I want to go on record saying they are saying that this increase in the gap between men and women's death and the reduced life expectancy is 40% of it is due to COVID-19 deaths. Okay. So now they're saying that it is now pretty much preventable because of what they have now in vaccines and therapeutics. So what I'd like to do is revisit this in another year or two, and let's see if that number has changed or has improved.
Yeah.
Because my gut says that it will not.
Yeah. Yeah. You know, the trend is there's a widening gap of people who live to be 90, 100. And I think in our generation, we're going to see a lot of people living to be over 100. And then we're also going to see a lot of people dying before the age of 40.
Well, we did that article on the Blue Zone a while back, right?
Yep.
And if you just research that alone and look at those, what people in those areas are doing, you don't have to move to a blue zone to do all of those things. They're exercising more. They're out, taking deep breaths, in clean air. They're eating well. They're adopting a lifestyle of activity and wellness. You can do that no matter where you live. Now, some places, obviously, maybe if you're in a smog-ridden city, it might be harder to get clean air, but you can go outside of the city. Most everybody has a car or access to transportation. Go on a hike. Go, we became even more outside active during COVID.
Yeah.
Right?
Oh, yeah.
Like we were going to parks, taking the kids riding bikes.
Long hikes, yeah. Bike riding.
We shouldn't lose that. We should be doing that stuff all the time. Be active. Go do something fun outside.
We should go right now.
Let's go.
Let's do one more article.
All right.
So anyways, I just want to make sure everybody knows, don't look at the life expectancy numbers. They're not accurate.
Yes. U.S. veteran gets world's first eye transplant.
Wow.
So this is very, very sad story. There was a guy, Mr. James. He's a veteran. Thank you for your service.
Absolutely. Thank you.
He was a high voltage utility line worker from Arkansas, or if you're from Kansas, we say Arkansas. He lost most of his face and when it was accidentally torched by a 7,200 volt live wire in 2021. On May 27th this year, he underwent a rare partial face transplant in addition to the eye transplant, which involved more than 140 healthcare workers, and it was a 21-hour surgery.
Wow.
Surgeons at NYU who performed the complicated surgery said on Thursday that Mr. James, who's 46, was recovering well from the dual transplant, and the donated eye looked remarkably healthy. His right eye still works. So his left eye, they have it all hooked up. It's blood flow is happening, but they don't know if it will ever actually send images to the brain. That is the hope. But this guy has such a great outlook. He's just so thankful for what's, the treatment that he's gotten. He said the doctor said that they're not claiming that they're going to be able to restore his eyesight, but there's no doubt that they're one step closer to be able to perform these kinds of transplants. Now, just for a little bit of background, I found it kind of interesting that it was 1967 when we actually performed the first successful heart transplant.
Wow.
You know what I mean? So that's really not that long ago if you think
Right.
about it. And it was, let's see, there were also a few others.
Less than 60 years ago.
Yeah, 1950 was the first successful kidney transplant.
Wow.
So I just thought that was very, very interesting. And we know from prior articles, the eye is such a unique and tough organ to actually transplant or work with because it doesn't follow the same immunity as the rest of our system does. Like there's so many, the eye is just such a different organ.
And
But
the optic nerve is very intricate.
yeah.
You literally have the optic nerve, and then you have 3 other nerves that control eye movement and dilation and constriction of the eye.
Which is for the light,
So
right?
so yeah, so so you have 4 separate nerves that go
Yeah.
go to the
amazing.
eye.
He said there was direct blood flow to the retina, which is the part of the eye that sends those images to the brain. But while there's no certainty that Mr. James will regain his vision in the new eye, doctors do not rule out the possibility either. And Mr. James said if he can see out of it, that's great. But if it'll kickstart the next path in the medical field, he's all for that too. So I just think that's fantastic. He said the donated face and eye came from a single male donor in his 30s. During the surgery, doctors injected adult stem cells from the donor's blood marrow into the optic nerve to encourage its repair. So we read that was something that was done.
Yeah.
Stem cells were used on the other eye transplant that we
Right.
saw. So just really, really cool things. That's the kind of technology in medicine that is really exciting to me.
I agree.
Because I go, this is what medicine is for. It's for those instances where we have these massive, horrific accidents
Yeah.
like this,
Oh yeah.
and we're able to
If
give
something
somebody a
burns
semblance
my
of
face off,
normalcy.
don't call the chiropractor.
100%. Now, I don't know. Can I show this, Sean? I have a picture. So this
well-
it's a little graphic.
Yeah.
I
Well,
should've said
Sean
that to
can
you first.
actually put it in the frame.
Yeah. But so neat. I'll have you do that. And it has his pre-injury picture, his pre-transplant, and then 5 months post-transplant. Really amazing what they were able to accomplish. So I'll give you that. I was thinking too, we were talking the article before this about your Homewood talk. Maybe we can put that link to that talk in the description also.
Absolutely. You look at this and you see this progression and you go, oh, that's really cool. But we have no idea the suffering, the pain, the agony, how many surgeries he's had. It's just amazing. What a great guy to be so thankful
Yeah.
and to make the best of his life and do what he does. And
100%.
we need to honor him. And then he served in the military, and then this accident happens, but that's also service. Being on this high voltage as a lineman,
Yeah.
these are guys who climb these poles
Yeah.
and work to make sure you and I have electricity in our buildings,
100%.
in our homes, and so on. So I thank him greatly. I remember an article I read. This was probably 20 years ago. And I wish I remembered it sooner so I could look it up. But there's a guy who had a hand transplant.
Oh.
So he had lost his hand. They attached a donor hand from a cadaver from someone who had passed away, and 20 years afterwards, he was able to move it a little bit.
Oh, wow.
Like the whole time, it was just a hand. It had blood flow,
Right.
but he couldn't use it. It was just for looks. And then all of a sudden, he started to be able to move it a little bit.
That's wild.
Years and years later, I wonder what happened to him now. I mean, that was years ago. So
We
I
should
wonder.
look it up.
Yeah, I think that'd be so interesting. Anyways, we went through the gamut today, starting
did.
out with AI and insurance denials
Our favorite.
to seniors having a lot of falls. Please train in coordination and balance, strength. When we say our podcast is geared towards helping you feel better and get stronger,
Yeah.
you have to be stronger. You're either getting stronger or weaker. There's no staying still. So you have to work on getting stronger.
Yeah,
That's
let's do
how
it
you live
together.
longer and feel younger. So
And be in a community that's active. Like
That's
that's
right.
part of it. You will do what the people around you do. So if you're looking for a community that's active, that's engaging, that's trying to find the great things to do in life,
those are people who are beating that life expectancy number.
100%. Well, come over and see us. Ask us questions. Shoot us an email. Engage with us. You do not have to be in our patient base to have those conversations. We're happy to have those. If you want to come down and see how your nervous system is functioning, we'll help you with that too. But do things that are truly preventative. Not, you have to know what your level of health is now so that you can improve it. Don't shy away from that. Don't let fear or busyness keep you away from being intentional with your health. It's important.
And laugh a lot.
Laughing is good.
Wow. Great job. Thank you. And we'll see you next time, next week. Same time, same place.
That's a wrap.